Okay, so now that we have a little more understanding of how we produce laser light, we're going to talk just briefly about some of the other categories of light therapy. Our main focus is going to be on the laser because that's what device we have and it's also what's most common out there, but just wanted to introduce you to some of the other concepts as well. So remember that laser light is monophasic, monochromatic, non-divergent, and coherent. When we talk about the LEDs and the SLDs, these use a semiconductor diode versus a lasing medium that we talked about. And those semiconductors are not all monochromatic and the light they produce is not all in phase. So we take away kind of those two components of the laser light. And so that also means that we don't get those specific benefits that happen because of that type of light being created. Usually LEDs and SLDs are all within the visible light spectrum. So that's also different. We can have lasers that are UV to infrared, but our LEDs and SLDs are in the visible light spectrum. The energy will pass through the semiconductor. The diode gives off photons, but again, they're not monochromatic and they're not in phase, and there's also more scattering than with a laser. So they're more divergent or than the laser beam is. SLDs typically are brighter, so they seem to be more effective when we start talking about actually penetrating the tissue and treating conditions in the body than the LEDs. They send your light just one direction, whereas LEDs are more scattered. Again, if we're talking being more scattered in general, that means less energy to the tissue, which means less depth of penetration. So SLDs are just slightly deeper than our LEDs, but they're not as deep as our lasers can be as well. So what are we talking about with light therapy? We are talking about photobiomodulation, which is the act of modifying a biological process with light. What happens is in your body we have these molecules called chromospheres, which are molecules that would react to light. So the two most typical ones are melanin and hemoglobin. And they absorb light at very specific wavelengths, which is why the wavelength of your laser, your light therapy unit, could affect what type of treatments you have. The exact way in which the lasers affect tissue have not been definitively determined. Okay. Again, we know the body responses to laser application is specific to that wavelength. We know that things are occurring. We can measure the effects, but we're not quite sure, besides the fact that these chromospheres are active with light, exactly how all of these effects happen. We'll talk a little bit about some of them that are being theorized and some things that they've measured, but the exact mechanism is not fully studied yet. We do know that it acts at the molecular level. We know that longer wavelengths give us more depth. So longer being 800 to 1,000 nanometers gives us more depth into the tissue, because we're usually talking at most, 2 centimeters deep as far as our direct responses go. So we can have direct effect, and that's due to the actual absorption of the photons at that level, and that happens typically maybe that might only be millimeters up to 2 centimeters. And then we have indirect effect, which are all the chemical events caused by the interaction with those photons that have now been absorbed in that superficial layer of the tissue, and that can go deeper. So that can go from the 8 to 15 millimeters up to 2 centimeters, even a little beyond that, depending on the interaction. So we have direct and indirect effects that can occur. And again, different lasers with different wavelengths are going to have different effects. So like a helium neon, the direct really only goes about 8 to 15 millimeters, but then we can get indirect greater than that. And they have specific wavelengths of about 632. So that's a fairly superficial one, if we know that our longer ones, 800 to 1,000 nanometers, get deeper. The gallium arsenic ones, they can go about 2 centimeters deep with their direct, and then their indirect can go deeper from there. They're closer to 904 to 910 nanometers. So they're more in that infrared range. And they produce a little more power, like 2 milliwatts of power. The gallium aluminum arsenic ones are, in theory, deeper. Hasn't quite been measured effectively yet, but they're, again, 830 nanometers, but they have a lot more power behind them. So they can go up to about 30 milliwatts of power kind of in each diode, and there's usually 3 of them. So you can get potentially 90 milliwatts of power in that area. So when we talk about the effect of the laser on the tissue, the magnitude of that effect is based on several things. You have the frequency, and that is going to be what determines how much gets absorbed or reflected or transmitted based on the density of the tissue, on the chromospheres in the area, things like that. The power density, so how much irradiance does the laser have behind it, so the power, which we usually measure in milliwatts, and then our duration of treatment, okay, so the length of time, and the vascularity of the tissue, the target tissue. So the more vascular, usually the more approach and the more effect that we have. A lot because hemoglobin being one of the chromospheres that are more likely to interact and absorb those photons. Also important to know the optical window, which is based on the type and consistency of the tissue. It's how well the laser light's going to travel into the tissue. So power will also affect the depth, the wavelength will affect the depth, and the consistency or type of tissue that you're targeting will also affect its depth as well as the effectiveness of the treatment. So some of the observed positive effects that are happening because of those direct and indirect effects of the photons being absorbed are including pain relief, increase in fibroblasts, increased collagen production, and increased ATP synthesis. So most of what we're going to see in our next slides are going to really focus on how these effects then happen in the body and how we can target those for certain treatments.